Hi everyone, welcome back to your channel name. Today we're diving into a crucial topic that affects millions worldwide, diabetes. Now, I know the word diabetes can sound scary, but knowledge is power. We're going to break down the top 10 complications of diabetes, explaining exactly how they can impact your health and, most importantly, what you can do to manage or even prevent them. Whether you're living with diabetes yourself or supporting someone who is, this video is packed with valuable insights to help you take control of your health. So, grab a glass of water, get comfy, and let's get started. First on our list is a serious one, cardiovascular disease. You might know it better as heart disease and stroke. See, diabetes significantly increases your risk of these conditions. Why? Well, high blood sugar acts like sandpaper on the inside of your blood vessels, causing damage over time. This damage makes it easier for plaque to build up, narrowing those vital pathways and restricting blood flow. And when blood flow to your heart or brain is reduced or blocked, you're looking at a heart attack or stroke. Now, don't panic. The good news is that managing your blood sugar is like putting a shield up against this damage. Keeping those levels in check, along with managing your blood pressure and cholesterol, is like giving your heart a fighting chance. Think of it like this. You wouldn't drive a car without regular maintenance, right? Managing your diabetes is the same idea. It's about keeping your body's engine running smoothly. We'll talk more about how to do that later in the video. Next up is neuropathy, which is a fancy way of saying nerve damage. High blood sugar, if left unchecked, can actually damage the delicate nerves throughout your body. This damage often shows up as pain, tingling, or numbness, especially in your hands and feet. Imagine feeling like you're constantly walking on pins and needles or that your hands are asleep. Not exactly a fun experience. Neuropathy can make everyday tasks difficult and even lead to balance problems and falls. The good news is that managing your blood sugar is like hitting the brakes on nerve damage. By keeping those levels in a healthy range, you're protecting your nerves from further harm. And here's another crucial tip: regular foot care is a must. Check your feet daily for any cuts, sores, or blisters, because even small wounds can turn into serious infections if you have neuropathy. Now, let's talk about your kidneys. These bean-shaped organs are like your body's filtration system, constantly working to remove waste products from your blood. But high blood sugar can put a real strain on them. Over time, uncontrolled diabetes can lead to nephropathy, which is essentially kidney damage. This damage can impair your kidney's ability to filter your blood effectively, potentially leading to kidney failure in serious cases. Think of it like this: if you keep pouring dirty water into a filter, eventually it's going to get clogged up and stop working properly. The same goes for your kidneys. The good news is that you have the power to protect these vital organs. Keeping your blood sugar levels in check is crucial for preventing or slowing down kidney damage. And here's another key factor: managing your blood pressure. High blood pressure adds extra stress on your kidneys, so keeping it under control is like giving them a break. Let's move on to a topic that's near and dear to my heart: your vision. Diabetes can affect your eyes, specifically the retina, which is the light-sensitive tissue at the back of your eye. High blood sugar can damage the delicate blood vessels in the retina, leading to a condition called diabetic retinopathy. Over time, this damage can cause blurry vision, floaters, and even blindness in severe cases. It's like looking through a window that's slowly becoming more and more clouded. But here's the empowering part: early detection and treatment are key. Regular eye exams are crucial for catching any signs of retinopathy early on, when treatment is most effective. Think of these exams like tune-ups for your eyes, ensuring that your vision stays sharp and clear. Now let's talk about a part of your body that often gets overlooked: your feet. Diabetes can wreak havoc on your feet, mainly due to two factors: poor circulation and nerve damage. High blood sugar can narrow the blood vessels in your feet, reducing blood flow and making it harder for wounds to heal. And as we discussed earlier, diabetes can also damage the nerves in your feet, leading to numbness and loss of sensation. This combination is a recipe for disaster, as even small cuts or blisters can go unnoticed and develop into serious infections. But don't worry, there's a lot you can do to protect your feet. First and foremost, check your feet every single day. Look for any cuts, sores, blisters, redness, or swelling. And remember, even if you don't feel anything, that doesn't mean there's not a problem. Did you know that diabetes can also affect your skin? It's true. High blood sugar can make you more prone to a variety of skin conditions, from dryness and itching to more serious infections. Think of it this way. High blood sugar creates an environment where bacteria and yeast thrive, increasing your risk of fungal infections, bacterial infections, and even slow wound healing. And if you have nerve damage, you might not even feel these skin issues until they become severe. But don't worry, there's a lot you can do to keep your skin healthy and happy. First and foremost, keep your blood sugar levels in check. This is like building a fortress around your skin, making it more resilient to infections. Next up, good hygiene is key. Wash your skin daily with mild soap and water, and be sure to dry thoroughly, especially in those folds and creases where moisture tends to linger. Chapter 7. When your stomach slows down, gastroparesis. Now let's talk about a complication that can really impact your quality of life, gastroparesis. This condition, which means delayed stomach emptying, occurs when the nerves and muscles in your stomach don't work properly. As a result, food stays in your stomach longer than it should, leading to a host of unpleasant symptoms like nausea, vomiting, bloating, and feeling full quickly. Imagine feeling constantly full and uncomfortable after eating. Not exactly a pleasant experience. Gastroparesis is more common in people with diabetes, especially those who have had the condition for a long time. While there's no one-size-fits-all cure for gastroparesis, there are ways to manage the symptoms and improve your quality of life. Working closely with your healthcare provider is crucial for finding the right treatment plan for you. Chapter 8. Can diabetes affect your hearing? You might be surprised to learn that diabetes can even impact your hearing. High blood sugar, over time, can damage the delicate nerves and blood vessels in your inner ear. These structures are essential for transmitting sound signals to your brain, so any damage can lead to hearing loss. It's like having a fuzzy connection on a phone call. The sound is there, but it's not clear. The good news is that managing your blood sugar is like turning up the volume on your hearing health. By keeping those levels in check, you're protecting those delicate structures in your ears. And here's another crucial tip: regular hearing checkups are essential, especially if you have diabetes. These checkups can detect any hearing loss early on when treatment is most effective. Chapter 9. The conversation we need to have: diabetes and sexual health. Let's talk about a topic that often gets swept under the rug: sexual health. Diabetes can affect sexual function in both men and women, and it's more common than you might think. In men, high blood sugar can damage the nerves and blood vessels that control erections, leading to erectile dysfunction. In women, diabetes can cause vaginal dryness and decreased libido, making sex uncomfortable or even painful. These issues can take a toll on your relationships and self-esteem, but it's important to remember that you're not alone. The first step is to talk to your healthcare provider. They can help you understand the underlying causes of your sexual dysfunction and recommend treatment options that are right for you. Chapter 10. Protecting your mind, diabetes and cognitive health. Last, but certainly not least, let's talk about the connection between diabetes and your brain. Emerging research suggests that diabetes may increase the risk of cognitive decline and dementia, including Alzheimer's disease. High blood sugar, especially over a long period, can damage blood vessels and nerves throughout your body, including your brain. This damage can impair cognitive function, affecting your memory, thinking skills, and overall brain health. Now think of it like this. Your brain thrives on a steady supply of oxygen and nutrients, which are delivered through your blood vessels. When those vessels are damaged, your brain doesn't get the nourishment it needs to function at its best. The good news is that you have the power to protect your brain health. Managing your blood sugar levels is like giving your brain a fighting chance. Outro: take control of your health. That wraps up our list of the top 10 complications of diabetes. We covered a lot of ground today, but I hope you walked away feeling empowered, not overwhelmed. Remember, managing diabetes effectively involves a three-pronged approach: regular monitoring, a healthy lifestyle, and staying informed. Knowledge is power, and the more you know about diabetes, the better equipped you'll be to manage the condition and live a long, healthy life. If you found this video helpful, don't forget to give it a thumbs up, subscribe to the channel for more informative content, and hit that notification bell so you never miss an upload. And as always, feel free to share your thoughts or questions in the comments below. I'd love to hear from you. Thanks for watching, and I'll see you in the next one.